So thank you so much, everybody, and welcome. As I mentioned, I am grateful to be here, and I'm so grateful to be asked to speak today at this culminating conference. And I thank Dr. Worthington and Dr. Masuda for the supports and the connection that we've shared over this past year, and indeed, that goes way back. I'm always impressed with the quality and depth of students' engagement and participation. I'm going to see how I move my slides here. Let me just check. There we go. So this year, I was very privileged to work with Crystal on her project, and truly the privilege was mine as a co-learner traveling with you, Crystal, for a moment on your lifelong learning journey. The energy, enthusiasm, grace, and competence that you all, as a group of graduating students, bring to the field as new practitioners is exciting and very welcome. What a hopeful time of transition. Today, I will share some experiences to shine a light on the practice of public health medicine and the ways that public health shows up in our communities. But first, a little bit about me. So, I am a public health and preventive medicine specialist with the fellowship at the Royal College of Physicians and Surgeons of Canada. I'm a family physician fellowship at the College of Family Physicians of Canada, and being dually qualified in both Canada and the US in the broad field of public health and preventive medicine. And a primary care provider is a unique, valuable skill set. It allows me to connect with both clinicians and individuals at the clinical level and help guide policy, legislation, regulation, and collaboration at the highest levels in regions, provinces, and sometimes the country. Also, I have an MPH. I've always loved being in education. And for you, it's quite an accomplishment to complete the master's level academic material and synthesize that content in practicum projects. Many of you studying and juggling other responsibilities. In your projects, you put theory into practice, and maybe those efforts ultimately reveal a completely new world of opportunity or implementation challenges and potentially frustrations. So kudos to the graduates for getting through these ups and downs as you plan for your next stage. In my work, I'm a medical health officer for Island Health. I am responsible for protecting the health of the population, preventing disease and injury, promoting wellness across the lifespan in all settings for the population in central Vancouver Island. It's a big job and it takes a team. So it is from this perspective that I am sharing some reflections for you today, maybe to whet your appetite as you embark on your new careers. Before we move on though, I want to share a few words about awe and wonder. This is an article from the Harvard Business Review about awe and its benefits. University of Michigan psychologist Ethan Kross defines awe as the wonder we feel when we encounter something powerful that we can't easily explain. Often the things which bring us awe have an element of vastness and complexity. Think of a starry night sky, an act of great kindness, or the beauty of something small and intricate. During your workday, the colors of the leaves outside your office or an act of sacrifice by a colleague could prompt a similar feeling, especially if you are attuned to it. Cultivating experiences of awe is especially important and helpful now as we renew our energy and make plans for a more hopeful future. That's because beyond the physical effects, like tingling and goosebumps or a lowered heart rate under stress, awe also affects us emotionally. One experimental group, when asked to draw pictures of themselves, literally drew themselves smaller in size after having an awe experience. Such an effect has been termed unselfing. This shift has a big benefit as you tap into something larger than yourself. Your sense of self shrinks, so too do your mental chatter and your worries. And at the same time, your desire to connect with and help others increases. People who experience awe also report higher levels of overall life satisfaction and well-being. Yesterday morning, Dr. Greenwood shared some messages about interconnectedness and determinants of health and wellness, the importance of natural environment and connection to land, the wellness of it for wellness of Indigenous people. Indeed, connecting to nature is evidence-based medicine for everyone and an important determinant of health. Determinants of health that meet our basic needs like shelter, food, peace, and education are described as prerequisites of health in the Ottawa Charter. Dr. Greenwood also spoke about how systemic and structural barriers racism, and other factors influence the determinants of health, and how those structural factors, like social norms and beliefs, continue to impact individuals' health due to racism and discrimination. Dr. Greenwood also emphasized social connection, relationships, and interconnectedness. Social connection is human nature, and isolation and loneliness lead to disease and ill health. We thrive on connection and belonging. Humans are not only connected socially, we also recognize the interconnectedness of humans with all things. Like any living beings, we can despair when disconnected. We see it every day in our communities. And disconnection has worsened through the pandemic. It might seem a bit flaky, but we are really connected through molecules and energy. It's unsurprising to hear how social and physical environments can influence our health directly and indirectly. The GenWell Project is a national not-for-profit initiative. I just wanted to bring it to your attention. It's a wonderful public health initiative with a health promotion focus, led by a dynamic individual, Mr. Pete Bombachi, who spearheaded the Movember advocacy efforts, despite what we think of mustaches. The GenWell Project promotes human connection and the benefits of social connectedness. There is an upcoming GenWell weekend in early May. Participate in your community and increase your social health. You can assess your social health by taking the GenWell Social Health Assessment Quiz. A bit more about me. I'm not that character. I began my own learning journey as a pharmacy technician in Winnipeg and Calgary, and over time I grew restless and I embarked on my university education as a mature 30-year-old, no less. Maybe somebody would question that maturity, but I had imagined myself becoming an ecologist or an environmental scientist, and for a host of reasons, I switched from ecosystems to cellular and biochemical studies. Fascinated by chemistry and biochemistry, I completed my Bachelor of Science at the University of Calgary. Further pursuing my interests in sciences, I applied persistently to medical school and was excited to embark on my medical training at age 35 at the University of Manitoba. My son was 18 months old, my partner worked hospitality service, and by necessity, we had a very tight system for 4 years of medical school and 5 years of residency, relying very heavily on family. We could not have succeeded without supportive family. We lived right next door to my mom. Connection and supports are so important to health. It was the success factor for our family. I did not become the ecologist or environmental scientist I thought I wanted to be, but life is funny sometimes, and that my training in public health and preventive medicine would bring me full circle to issues in environments and ecosystems. I'll just go back. My early work in Northern Health included work with environments, natural resource development, and the interface with health and communities. Dr. Greenwood was my office neighbor at Northern Health. Mr. PG, seen in the picture, is the mascot of Prince George. Some mascot. I lived there for 5.5 years, but of course, logging, pulp, and paper are central to the economy for ages. And so the legend of Mr. PG lives on in the north. And as I mentioned, in the north, we could see impacts to First Nations communities, especially from resource development. Resource development brought negative influences to community, but also the benefit of improved economic viability and sometimes community amenities. I engaged with academic partners like Dr. Masuda, Dr. Parks, and others to find answers. Researchers are good connections to have, for sure. It was important for us to understand the community perspective, the community voice, and their experience of industry, health, and community. Community consultation and engagement reports detailed the story. Dr. Greenwood and her team were fundamental in helping us to refine our engagement. I learned early that listening to the community, my patient, is most important. Some communities have concerns about industrial or resource extraction sites that are unmitigated and sometimes abandoned. Contaminated sites are present in many areas of the province. Public health shows up in these situations by supporting the community, our patient, and exploring their concerns. I recruit a team of experts from academia, BC Centre for Disease Control, BC Cancer Agency, Health Canada, and ministries to examine evidence for environmental contamination, human health effects. It takes a lot of coordination to bring all the right partners to the table and keep the projects moving forward. Banks Island in Northwest BC is sacred land to the local nation. Mining impacts to the land have been highlighted in the news. It's only one of many mining sites where there are concerns. Public health has a role in health protection in contaminated sites, as well as navigating the intersectoral spaces with provincial and federal partners, with local communities and nations. Another issue, and this is really the essence of public health and my work on a day-to-day basis, is the need to pivot. Extreme weather that we have experienced in the province over the past several years, atmospheric rivers, flooding, landslides, heat domes, and heavy snow are increasingly frequent natural hazards that threaten infrastructure and services. Island health teams are working to support climate preparedness in community to respond and mitigate impacts of extreme weather, just one outcome of climate change. The plans direct action to protect water systems, food systems, supply chains, information technology, and other resources. Communities need to lead those plans for preparedness and mitigation for those plans to be effective. We also grapple with the effects of globalization. The rapid mobilization of people from hemisphere to stratosphere and back has contributed to many amazing opportunities and challenges. Globalization has increased global interconnectedness and has been positive by improving the quality of life for many countries. On the other hand, there have been negative impacts of globalization, such as increased global inequalities, increased corruption, loss of jobs, environmental degradation, to name a few. To deal with the negative effects of globalization, countries can adopt a series of policies aimed at reducing said impacts, not limited to investing in new technologies, implementing anti-corruption policies, and implementing policies that protect human rights. Certainly, globalization was a factor in the pandemic. The movement of people and commodities and connection across millions of miles contributed to many challenges over the pandemic. We need local economies to be vibrant and resilient. We're amidst a community recovery challenge. The pandemic has eliminated many of the things that we relied upon in some ways. Things that were inherent in some communities in the past have been lost. Maybe the sense of community has been lost. A sense of community and connection with much division amongst families and communities, and maybe some of you have experienced that yourself. It will take time to recover this comfort, and we need to reunite communities through finding common ground. A sense of safety. Many people still have ongoing fears of infectious disease. For those who had not contemplated their own susceptibility to infections, the newfound fear can be crippling and inhibit the ability to connect with others. Further fears related to escalating social disorder contribute to community disconnection. A sense of collective impact and common humanity. Being isolated in small bubbles in your social circle has somewhat left us disconnected and potentially suspicious of others. True community begins with collaborative and cooperative stance on how to create belonging, safety, and connection amongst members of community. And affordability, livability in our communities. The cost of thriving, living, and even surviving has increased dramatically over the pandemic, with healthy nutrition, organized physical activity, and even shelter becoming out of reach more than ever before. We see the growth, well, connection, belonging, safety, collegiality, affordability, the things I just mentioned, these are determinants of health and wellness in other terms. We talked about the determinants of health earlier and those structural and system factors. We need to ensure the basic prerequisites for health and the determinants of health are adequately met so that we can create the conditions for mental, physical, and spiritual wellness. Those best impacts will be realized when we begin to address structural and systemic inequities. We have to be the architects of this in our communities. I think that's where you guys come in. We see the growth of significant urban issues with inequitable access to housing, employment, education, and as mentioned, influenced by race, gender, and other personal characteristics. The high rates of mental health issues compounded by the pandemic, together with worsening poverty, deprivation, continue to contribute to the increasing use of substances to cope. This is the confluence of the structural, systemic, and individual factors described by Dr. Greenwood yesterday. And I ask, have our human rights and their human rights been considered? Often they're not. The hopelessness of being houseless and others and othered so severely. I had a term the other day, it came to me, thought about significant others being so important, but what about insignificant others? I think that's something that we have to consider in our communities. People are hopeless on a background of trauma for some, and that results in coping that's, let's say, disordered coping. You know, using an unregulated drug supply, it's causing death and disability that continues to rise every year. And meanwhile, we fail to recognize that many mainstream community members still cope with their stresses and other means like shopping, social media, sex, or gambling addictions. But those that are coping by using unregulated substances are dying at higher rates than ever before. Our community harm reduction teams are working with peers to incorporate peer feedback and experience into service planning to make services more accessible, to extend into community through peer efforts to reach the unreachable. The toxic drug crisis has impacted each community and each community member so uniquely. I think everybody can see their spot on the tree here as we cope. So graduates, what's in this for you? How do you make sense of all this? Find your path. See yourself in the solutions we direly need. All you need to do is look at the newspaper and read the headlines. I looked today, there's dozens of headlines that I could think about that are public health issues. Some of the dilemmas we currently face are the greatest challenges we've ever encountered. Climate change, toxic drug crisis, environmental contamination, sustainability of resources like our precious water. You're now ready to embark on your careers as competent health professionals, ready to make an impact on the health of the population. Bravo, and I mean that. Some of you may even gravitate to the title policy wonk by now, or maybe someday you will. We need you, we need your energy and enthusiasm, your ideas, and more importantly, we need each other. Public health, this is not a job you can do in isolation. I learned this over time, particularly with the rapid adoption of video conferencing. We've become more isolated and rushed. The pandemic has us running. My partners noticed that and let me know. Dr. Allison, how am I doing for time right now, by the way? Pretty good. Dr. Allison, can you slow down? Awesome, perfect. We were worried about COVID cases in schools. Working the case and contact management file, I was getting down to business. Yes, we all need to slow down. You cannot have connection and belonging when we're rushing. We don't make time for each other then to actually see each other. We have to stop the grind. We have to stop the rush and just be together. Human beings, not human doings. I like that one. And connection before content. When we slow down, we become better listeners. We let pauses become silence. Create that space, don't fill it up. Listen. There are more studies out there than I care to admit about how quickly a doctor will interrupt you before you even get started on your story. 11 seconds. I thought it was 30 seconds. We need to listen carefully to each other. Indeed, sometimes we have to listen to each other to allow one to empty themselves of their story, to validate them into existence. Allow that. It's not only cathartic, but it heals. Your caring heals. The connection heals. Recent studies have shown that the placebo effect is based on relationships and the caring within. We cannot overstate the importance of connection, the most important element for humans. We are social beings. We need each other. By slowing down and seeing each other, listening to full stories, holding space, not filling the silence, we can experience stronger connections and improved wellness. And through this connection, we show our compassion, patience, and shared humanity. Yeah. So look up. Do look up. And there's a movie, Don't Look Up. Remember that? I didn't talk about misinformation, but holy smokes, they made a whole movie about it. It was awesome. If you haven't seen it, watch it. It is this common ground, a shared human experience, that will improve our approaches to our current and future challenges. Presently, many people have become fearful, judgmental, divided, and sometimes misinformed. We can apply our approach of slowing down, listening, connecting, and acknowledging the shared human experience to draw us closer to our community and what they need. And with the current realities that we're faced, we need an approach that draws communities together. We're facing significant challenges that require us to work collaboratively. The pandemic showed us that our efforts are more impactful together. The big structural elements that Dr. Greenwood mentioned, like legislation, policy, social norms and beliefs, and history, are remarkably influential in wellness efforts. The pandemic has taught us to work collaboratively. Environmental health affects us, both social, physical environments, they both matter. Climate preparedness is an opportunity to unite us. And I reflect heartily that Indigenous relations educate us if we take the time to be humble and unlearn. So here you are at the doorstep with your new knowledge and skills and attitudes and brilliance. You're all so shiny right now, a room full of brilliance if I were there in person. Please continue to shine. You are stars and you inspire awe in me. So thank you, everybody.